Our focus today and really our mantra is going to be choose simple. As I was putting this together, I was just thinking about what we could all use in our life, and we could always use things that are a little bit simpler. So if you look at these two pictures I have on the first screen, it's a pretty basic OL prep, right? I mean, you can see the dentin, not a big deal. We're going to put one layer of blocker, a couple layers of Omnichroma, and we're going to get great, simple, easy results. And when I think about this prep and what I'm looking at, I basically think about dentistry as kind of like a map. We look at a tooth or we look at an X-ray, and what do we see? We see either the decay on one or the other, and it kind of creates this map for us of where we want to go. And so when we're looking at that, we want to have the simplest way to get from A to B, not the most complicated. When I used to do a cosmetic restoration, I'm going to show you one of those here very shortly. I would need to have a big palette like that of all sorts of different colors of composite. I'd have to pick my dentin shade, I'd have to pick my enamel shade. Sometimes there'd be a translucent on top. And then you hoped you got that all correct. Now, all you really need is the Omnichroma for the structural color, a blocker, and a flowable. So it's a really simple thing. And you have the flowable and the bulk flow to pick from now. The goal is that you try and stand out in the crowd. So for me, in my practice, I am a health-centered dentist. This means my goal is to help each patient become as healthy as they wish to be. So I take things like a single shade composite technique and use that to help build my philosophy and to stand out. So this is Lily, and this is her before and after. So this is the first case study I'm going to show you that shows a before and after picture. Here's our slide of the X-rays. There were no pulp exposures. There was sensitivity, and obviously it was rough. And here's Lily's plan. We did a class 4 Omnichroma restoration. We used blocker and wetting resin. I'll go through this in detail in a minute. So when you take a look at what I did, you're going to add a layer of your blocker first. So when you look at this picture, you can see the layer of blocker. The blocker should run right up to your margin and a little bit over the margin. And you see how I start to get the shape of my tooth, but it's not the perfect shape. It just starts to kind of give you an idea. That's what I'd recommend. When you're thinking about blocker, less is more. You don't want too thick of a layer. My Omnichroma goes past my margin, close to the gingival margin. So keep in mind when you're etching the entire tooth in a situation like this. But look at how great this shade looks already. You know it's going to polish back and be really good. I took a course with the AACD many years ago, and they really talked about distinguishing between contour and polish. And I think that's important. Contour is getting your shape and getting excess off, not getting it shiny and pretty. I feel like when I was in dental school, I didn't know the difference. I would automatically be trying to get that final sheen before I was ready. And I'd end up taking off more composite than I wanted or not enough. A deep bite is not what you want, because when she's going to have lateral movements chewing, she could potentially hit the back of those teeth. So what you can do with composite that I'm going to show you in multiple cases is you can open the VDO. It's non-invasive, it doesn't require anesthetic, and it can be done in one visit. So if we take a look, this is a different case, but this is what I did for Lily. Being able to do a really predictable class 4 restoration like that in one visit that looks awesome. And then talking to them about the composites on the lower teeth in order to open the VDO to help protect them long-term, you set yourself apart. The health-centered treatment planning, that treatment planning from the desk and not from the dental chair, becomes super important because you want to point out the bonding needs for the patient before you start the clear aligner therapy. Not only does this give you, more profit in your case when you're done, but is going to make your patient so happy because the wear that they have before you straighten their teeth with the aligners is going to be more present and easier to see afterwards. Let's take a look. So here's a case. Here's her pre-op, very narrow arches. These are all the things that I wrote down. Obviously she needs a graft right there in tooth number 6. Her gum line is very uneven, and look at her lateral incisors. And first glance, you might think she just has really big centrals. She does have a fairly large number 9. It's much wider than number 8 with how that bonding was done, not by me. But her laterals are microdontic. And not only are they microdontic, but they're really dysmorphic. That tooth number 7 is really tiny. And one thing I want to point out that you should show when you're going to be doing these bonding cases at the end is see how she already has a black triangle space when the tooth is crooked? When that tooth is straight, she's going to have a really big black triangle space. Here is a pre-op photo, intraoral photo of what it looked like once the tooth was straightened. See how big that black triangle space became, and see how big that cleft is there with the recession. Those are things that need pointed out ahead of time so the patient's prepared that you're going to want to do something to make that better in the end. Now, different cameras took the picture, so I apologize for the color difference in that, but it shows you how nice that composite looked at the end and what a really nice tooth shape we got here. Here's her finished result. Gingivectomies helps the contour huge. There was her line before, there is it after. Now, I wasn't going to bring tooth number 8 up as high as number 9 because I don't want to create recession, but I was going to round and get the papilla much better over here on the left to match the right. And then when her lip line hits, it looks really nice. So that is just some awesome bonding. And I love how I get that sheen with the Omnichroma. And again, she did have the option of doing crowns or, veneers, but she chose the bonding option. So there's her before and there's her after. I feel like it turned out really nice. Clear liners, Omnichroma.